All right, small ruminants. If you guys have specific questions about any of this stuff, please email me, and if there's common themes, I'll post them online. Okay, small ruminants, we kind of lump them together because they share a lot of diseases. We actually had a discussion the other day in our faculty pathologist meeting that we don't really know enough about the specific respiratory diseases and syndromes of small ruminants because we kind of just treat them like large ruminants for a lot of things. Like, oh, just BBDD, yeah, they can get that. It's like, yeah, they can, but like, they actually, like, do we ever see a positive? So kind of an interesting discussion, more to learn. Research. All right, so there's the list. So this is enzootic pneumonia of sheep. This is the sheep respiratory disease, not what sheep call it, sheeping fever, sheepishly. Similar pathogenesis, identical lesions, stress, viral infection, secondary bacterial infection, septicemia, and death. Pathogens are overlapping, so sheep have their own RSV and their own PI, but there's a lot of cross infections with the bovine and ovine. And hemolytica, same. H-sonine, same. Same. Biebersteinian tribalosing is the weird sheep one. So we didn't talk about bovine contagious pleuropneumonia, so we're not going to talk about the pleuropneumonia, but they're basically the same. All right, let's spend some time on these because they're interesting and weird. The small ruminant lentiviruses. Lenti means slow. These are slowly replicating viruses. These are retroviruses. So HIV, SIV, FIV, retrovirus rules. These guys integrate into host DNA. So they are non-curable, right? Because they become part of the body. Not going to be able to, you can treat them to reduce viral load, but you're not going to be able to get rid of the virus yet. Work on it. So these cause progressive lifelong disease. Often they involve a component of immunosuppression, and it depends on the virus whether it likes to do immunosuppression or neoplastic transformation. But those are both retrovirus things because they're in your DNA and they're altering your genome. So neoplastic transformation is a theme for viruses. So in sheep, this lentivirus causes tumors of the nasal cavity. So this is a very large, probably an adenoma because it doesn't look very invasive in the caudal nasal cavity, nasopharynx. You can see we're maybe getting a little invasion towards the brain there, which is kind of concerning with the Caprine plate. These guys will present with upper respiratory signs, which is unfortunate because this is actually transmitted via nasal secretion. So they're burping and sneezing. I see a lot of faces like, ew, gross, virus cancer. It's cool though, right? Virus is common cancer. Could be cool. All right, so here's the other small ruminant lentivirus. I'm not even going to try to pronounce this. We're just going to call it bovine pulmonary adenocarcinoma OPA. All right, so this is another virally induced neoplasia. So it's a contagious cancer. They're always fun, primarily in sheep, but goats can also be affected. Pretty rare in North America, but if you travel, you might see it. And it's actually related to the nasal tumor virus that we talked about. So similarly, it's transmitted in respiratory secretions. Most infections are conducive. And infections that do progress. This is going to take a long time. So it's the slow virus, right? It's going to take a long time to cause this cancer and then proliferate. So this is a slow burn. The classic lesion is copious fluid in the lung there's so much in there that actually drains out when you lower the animal's head. So they're lowering this guy into a bucket and there's just fluid draining and draining and draining. That's a pathic pneumonic lesion. Here's what the lesions look like. So here's normal lung, soft and pink and fluffy. All this fairly well demarcated, gray to like tan. That's all adenocarcinoma. There it is on external view. These lungs look like they might be fixed. They're kind of brown, but you can see these multifocal white. They look pretty firm. lesions, fairly well demarcated. Main differential for this is regular flavor of pulmonary carcinoma, which is not common in anybody, but dogs passive in that mammal. Remember, so that'd be a weirdo. Oops. All right, one more lentivirus. This is the one that causes pneumonia and encephalitis. So OPP and CAE are related and very similar presentation. They are also infectious, so you can see OPP in goat, CAE in sheep less commonly, but has been documented cross species transmission. The disease presentation is pretty variable, so it can target a lot of different organs, lungs, especially. Question. Yes. So yeah, it kind of goes everywhere. Causes respiratory signs, encephalitis, arthritis. This one's fun. It causes mastitis, and the udder becomes so firm that somebody named this hard bag. That's gross. For CAE, the presentation is a little bit more dependent on age, with pneumonia involving your age. But we see encephalitis more often in young animals and arthritic.
To the OPA, does it cause other respiratory signs besides like just like the super drainy grossness?
OPA.
Yeah. Answer.
So the signs will be dependent on where the neoplasm is and what it's involving. So we have 80% reserve capacity, right? So you probably are not going to see dyspnea because it's not septic. The fluid is the big problem. So these are often very edematous. If that's taking up 80% of the lung, you're in trouble. I guess you could potentially get compression of a bronchus, but it's not typically. Yeah, it doesn't usually do that. Like here's some bronchi in here, and they're still open. I mean, this area is not functional. Did that answer your question? All right, so here's what OPT looks like. This is a classic picture of an interstitial pneumonia. So it's very diffuse, so it can be difficult to appreciate, but these lungs are so big and puffy and rubbery looking. Look how full they are. These did not collapse at all when we took them out of the chest, like an inflated balloon. Key to noting the inflated status of the lung from pictures, look at the edges. Especially this guy, it's like so inflated, it's actually like sticking out. Versus those normal lungs, the edges are often very like thin because they've collapsed so much. They're just like flappy nothingness. And then here's the cross section. It's classic, what we call hepatization, because this looks very much like a liver. It's totally solid. Concurrent infections, very common. I would say every sheep and goat that comes on the floor always has pneumonia and enteritis, and have yet to be proven wrong. They don't even open them. I'm like, I want poop and lung samples because it has pneumonia and diarrhea for sure. I'm like, how do you know, Dr. Ames? Because I'm not new here. Okay, nasal bots, they're kind of cute, but also kind of gross, especially if they invade through your cervical plate and into your brain. I forget if I mentioned this, but these are not eyes. This is not a cute smiley face. This is his butt. I thought these were eyes for the longest time, and I was like, oh, look, it's so cute. It's still cute, but it's fun. All right, lungworm. So much more of a problem in sheep and goats than in cattle. See this. Uvularis is the small lungworm. It's very, very common. The gross lesions, you can actually see the worms, but the big giveaway is these big subpleural nodules, and they're very autodorsal. So they're basically following the bronchial tree, and they're in the very autodorsal most area of deposition. So these nodules are actually big masses of worms and eggs. It's like a big worm orgy in each one of these. There's another one where it's you can see it even more clearly. These nodules are really protruding. Early species of lungworm are also a thing. Very similar in pathogenesis, but Probably not gonna remove nodules.